Thanks to medical advancements, young patients with heart conditions are living longer, healthier lives. But this success also brings new challenges. Community is anticipating these challenges and adding experienced staff to the Heart and Lung Institute to meet those evolving needs.
Well, I heard about the group here, and I, know people who have trained with me at the Cleveland Clinic, and I felt it would be a good fit.
Dr. Sujata Subramanian.
Dr. Sue is what most people call me.
Okay, Dr. Sue is one of those additions, a very experienced cardiothoracic surgeon.
I spent 15 years doing congenital cardiac surgery, and so to have a setup like this where I can, get the opportunity to build something would be huge for me.
And that's because she has a unique skill set. She has experience working in pediatrics, a surgeon taking care of kids who have congenital heart disease.
Patients are born with heart defects, and they can range from simple lesions like a hole in the heart to lesions where a whole side of the ventricular chamber or the side of the heart is not developed, and they require pretty extensive operations and reconfiguring of anatomy to restore their physiology.
The treatments and procedures have become so successful that these kids are living much longer, healthier lives.
So that brings up an interesting conundrum, right? A lot of these babies are now alive and they have become adults. What I'm referring to is adult congenital heart disease, and these are basically patients who were born with congenital heart defects and who've now grown into an adult range. And because they've aged out, they can no longer be taken care of in freestanding children's hospital. And so my coming here is to address that need and to see if we can create a program where we can funnel these patients to come under a common umbrella.
It's a big project, but Dr. Sue is diving in.
But my hope would be that we can recruit team members, perhaps a nurse practitioner who can liaise in both worlds, education of our staff members, existing ICU nursing staff, for instance, to teach them about what to expect and what to look for.
And while the program is in its infancy, Dr. Sue was already seeing patients and providing care so that they can stay in the valley and not have to drive out of the area.
I'm dealing with one such patient right now as we speak. She can't go to the children's hospital even though it's a congenital heart defect because she's 26, 27 years old. She probably doesn't have the means to travel elsewhere. Could she just come to us? Yeah, she could. I'm here. I could do it. We have all the infrastructure for it in terms of a really well-functioning operating team, a really well-staffed ICU, 3 hospitals where we perform these operations. So all the existing infrastructure is available. Now it's a matter of getting the service to grow and getting the information out there so that people are aware that they can come here and get this done.